The last speaker in this session is Mike Muehlenbein from Indiana. He does a lot of work on environmental change and its relationship to disease, but he's today going to talk about more on the same topic of health education and evolution.
Thanks, Dan. We'll get this over with relatively quickly and get to lunch, right? Good-looking group. So I, like many of you, have been inspired by some of our colleagues here, like Mark and Steve and Randy and Brandon, about how best to reposition evolutionary biology within medical education. And for me in particular, it's taken on the form of three specific questions. That is, how much evolutionary biology are pre-medical, pre-vet, pre-nursing, and pre-public health students getting? How do current health students and practitioners feel about the utility of evolutionary medicine? And can religious beliefs interfere with teaching of evolutionary medicine? So let me contextualize this by showing you the most recent Gallup poll. These started in 1982. The most recent one was in 2014, in which 42% self-identified as what you would call a biblical literalist. So these are young earth creationists, and the other majority actually accepting human evolution. But this includes not just evolutionists, but those who would self-identify as theistic evolutionists. If you look at some of the data, what I think is interesting are relationships with level of education and age. That is, those who accept human evolution tend to be younger and more educated. And if we look at a separate poll, there are actually several of these out here now, and I'm just showing you the most recent ones. This is from the Pew Research Center. This one indicates that approximately 60% of U.S. adults accept some aspect of human evolution, but again, this number might be a little bit misleading because it includes both the evolutionists as well as a significant percentage, 24%, being theistic evolution. That is, the accepting of human evolution, but with some divine guidance or source. If we look at the Pew data, we also see the relationship with level of education. You see postgrads here, so these are graduate students and onwards. 74% of them accepting human evolution. This is specifically accepting human evolution, excuse me. And you see the relationship with age again, so younger individuals being more likely to self-report acceptance. So if we look at university students in particular, there are only a few studies out there. Find this interesting that yes, a vast majority of them do agree with the statement that humans evolved from other species, yet a vast proportion of those, that is a majority of them, still request what some would call equal time, or the teaching of not just evolution, but also creationism and intelligent design, or ID. If we look at physicians, and this is the main study that I've been able to identify, the Middleman work, which is very, very similar to the results from university students, in that, again, a majority do accept some aspect of human evolution, but at the same time also prefer that a number of different theories are taught. And of course, Mark beats me to the punch with recapping Nessie and Schiffman's original study, suggesting 48% of 50 responding medical school deans considering evolutionary biology important. Of course, we'd like to get that number up as much as possible. And what they specifically reported, at least at this time, in terms of roadblocks, was lack of time in the curricula, as well as lack of faculty experience. At the time, likelihood of political controversy or lack of relevance for understanding medicine was much less likely reported. And as they summarized then and now with Brandon's and Mark's new study, medical schools are assuming a large part that undergraduates are coming in with an adequate experience in evolutionary biology. And they're not necessarily learning it as a basic medical science once they get to medical school. So for my purposes, what I did was I put my name in the hat and tried to get that NESCENT grant as well, and we weren't successful, but I decided to go ahead and pursue what I wanted to accomplish, at least in part of that project, which was a distribution of a very similar survey, but to 4 different audiences: those in medicine, both students and practitioners, those in veterinary medicine, those in nursing, and in public health. And so this survey was distributed electronically via the Evolution in Medicine Review website. Some of you may have even taken this survey. It was specifically also advertised to colleagues at a number of different institutions. The ones highlighted in yellow here represent where the majority of respondents eventually came from. The SUNY Binghamton School of Nursing in particular, because of Chris Reiber and Gary James and their involvement in teaching up there. Purdue University, which is the closest veterinary school to Indiana University. The questions ranged in variation from basic demographics as well as detailed information about education level to things like whether or not they regard evolutionary biology as a basic medical science, and what they, again, believe are some of the biggest obstacles, right? And of course, whether or not they'd be interested in taking classes on the topic, in what format, and then of course their religious beliefs, which were scored in a number of different ways. Most notably, the last 2 questions listed up here. Do you accept the process of evolution? And do you accept that humans evolved from other species? Left a little bit vague and open-ended on purpose so as to capture both, again, the evolutionists and theistic evolutionists, and really just to differentiate that group from the young earth creationists or biblical literalists. We obviously have to acknowledge the ecological fallacy, and that these results that are being presented now are not necessarily representative of the health practitioners and students in the U.S. today. On the left side of your screen, you see the number of original responses across the 4 different surveys, 663. But after I went through them, it was very clear that a lot of people started and then stopped their survey very early on. So we have a final sample size here of 557, and this represents 557 people who completed 100% of the survey, which was approximately 35 questions, so a pretty decent group. We look at some of the basic results. The majority of respondents for all except public health were students. 88% of those in the medical profession, those were students, and the remainder, 12% being physicians themselves. Those in medicine and in veterinary medicine were much more likely to have received a class specifically on evolutionary biology as an undergraduate. And you could see here on the rightmost column that the average number of classes dedicated to evolutionary biology that these individuals took as an undergrad are actually pretty decent, right? We'd like it to be higher. But in fact, no one in the entire survey reported they had 0 classes in evolutionary biology as an undergraduate. If we look at the penultimate column here, the scale of importance of evolutionary biology, this is on a scale of 1 to 10 of how important they feel evolutionary biology is for medical education, and it's a decent number, an average of about 6.8. Of course, we'd like that to be higher. And then in the rightmost column, the percent of those agreeing with the statement that evolutionary biology is a basic medical science, 78.6%. Being the average. Again, we'd like to see that number much higher. If we look through the open-ended questions, we see that most people have not heard of life history theory, Red Queen hypothesis, grandmother hypothesis. There are actually a lot of other examples out there. Few admit to understanding evolutionary approaches to senescence. Few admit to understanding the paleo diet, which I was surprised with. And few understanding the concept of mismatch. But almost all of them, all except one in fact, claiming that they have a very good understanding of the evolution of antibiotic resistance and variation in pathogen virulence. Just really quickly, the public health and nursing students were heard of evolutionary medicine much more likely than expected. And again, I don't know the explanation for the public health group, but the nursing group is again because of that group by Gary James out at SUNY Binghamton. Students were more likely to have heard of evolutionary medicine compared to practitioners. I don't think that's too surprising, right? What was surprising to me is that students were not more likely to accept evolutionary biology as a basic medical science compared to existing practitioners. I'm not sure at this point what that means. So to get to the good stuff, on the left column you see the proportion of individuals that accepted the process of evolution versus on the right column those that accept that humans evolved from other species. Some people might differentiate this between understanding micro versus macro evolution in reference to humans. Regardless, 76% is higher than the national average, right? Interestingly, just a little post hoc analysis, medical and public health students were less likely to accept human evolution compared to practitioners. Not sure why. We could talk about that. So what is the deal? Is religion a potential obstacle to incorporating evolutionary theory into medical practices? Well, if we ask them what they think their biggest obstacles are, it's again very similar to what Mark has mentioned in the past, and that is lack of time in the curricula, right? Most of them say, I'm sorry, these are reverse scores, so the lower the value, the more important they thought it was. But also lack of agreement about relevance of evolution in medicine, okay? So not necessarily lack of agreement on understanding what evolution is or even accepting it or not accepting it, but how relevant is it is what they seem to want to know. So I, like Mark, had a bunch of open-ended comments. In fact, every single person, every single respondent that disagreed, does not accept human evolution, left a comment. Of those who accepted evolution, 10 people left comments. And they were usually like, good job. In the former category, though, I've just lumped some of these comments that I'll go over very briefly. We could differentiate these between those who believe that evolution is unproven, those that would self-identify as young Earth creationists, old Earth creationists. A lot of support for ID, intelligent design. If I can draw your attention to the middle comment there, that is by a medical student who believes that the blood clotting system could not have evolved in humans without supernatural forces. And the bottom comment is a practicing physician who also reported that the digestive system could not have evolved without supernatural forces. And of course, a number of theistic evolutionists who don't disagree with human evolution. So these are now mainline Protestants as well as a majority of Catholics. That just believe that there is some divine guidance. So, to wrap up, does religious belief make a health practitioner worse at their job? No. Okay? With some caveats, I'll tell you. One caveat being there are a number of reported cases of religious-motivated medical neglect, but that usually happens on the part of the parents denying medication or vaccinations to their children. Specifically, there are only 3 states within the U.S. right now that do not allow religious exemption for vaccination, those being Oregon, Mississippi, and West Virginia. So what should we expect of our healthcare providers? Well, to not necessarily accept human evolution, but perhaps be able to understand that variation in the human condition is very normal, that it has a number of different explanations, and that some of the outcomes are not necessarily things that need to be medicalized. I would personally like my provider to be able to provide evolutionary explanations to things like preeclampsia and vulnerability to mental disorders, these kind of things. Let me skip ahead. For those who are unaware, the new MCAT, as of 2015, now does have a core competency in evolutionary biology, in which they're asking questions specifically on natural selection, speciation, adaptation, phylogenetics, and comparative anatomy. There's someone's taking pictures. You can go back and you can check out that website for specific information. Now, obviously, we would like those core competencies increased, right? And how do we do that? Well, if we've asked them several times and in many different ways, what do they want? It's almost unanimously seminar format rather than things like formal pre-med requirements or core curricula or even continuing medical education electives. So I leave you on that note. Thank you very much.